We can't enjoy the American dream if you don't have health and wellness. Joining us on the show, two of the best in the space. Andrew Wooders, the Director of Fitness with Dr. Christy Lamb, who is obviously a doctor, but you're also the CEO of Bold Health.
Yes.
So you guys are kind of a team coming on the show. Yes. Thanks for being here.
Absolutely.
Thanks for having us.
So let's talk about this online world. There's so many people that are presenting advice that maybe shouldn't be. There's a lot of noise, a lot of funniness, especially when you see life coaches and this health topic. You had mentioned to me, Christy, which I'm aware now, that you're physician-led with what you guys do with Bold Health. Explain what that means.
Yeah, so Chris Small and I are two physicians trained at UCSD and combined family medicine and psychiatry. And we started out doing general medicine, psychiatry, and realized that this world of the social media guru was out there, and that we had a lot of patients who were getting false information using Dr. Google to manage their health. And so we came together to create a wellness facility for medical health and mental health, as well as fitness and wellness, that's really driven by science, evidence. Evidence-based is kind of thrown out there a lot.
Sure.
But we actually run research through our clinic, and we're physicians who are board certified in family medicine and psychiatry, and really work to make sure that what we're doing is effective.
Yep.
And clinically backed.
Well, Dr. Google scares me.
Yes, you should.
I mean, you
Absolutely.
could just have like an itch on your foot, and
Right.
Dr. Google makes you think you're dying.
Right.
So I agree.
Exactly.
That's probably not the best place to get your health and wellness.
Yeah.
So we'll talk a little about like the physical training and you as the Director of Fitness. I want to go a little bit deeper on, so your background in psychiatry.
Yes, so went to med school at Georgetown, so I'm general medicine trained as far as a general physician, like somebody who would go see their primary care doctor.
Sure.
And then trained at UCSD in a specialized program for family medicine and psychiatry. So both Chris and I have delivered babies, can do stitches, can take care of general medical health, but also trains extensively in psychiatry. We were housed out of the St. Vincent de Paul homeless shelter. So we worked kind of in the trenches, doing the combination of medical care with chronic psychiatric illness, and then both had an interest in addiction and have started to kind of take that into the private practice realm to provide the best services that we can for really whole person care.
Well, it's a really interesting time that we're in.
Yes.
A lot more depressed people, a lot more anxious people. Shootings are happening everywhere.
You got
People
it.
are solving things with pills.
Yep.
So when you talk about things like mental health, it seems to me there's a lot of advancements being made that are old school things like consciousness, meditation, going on nature walks. How important is that stuff?
I'd say it's imperative. It's a huge part of anxiety, right? The bulk of our program is based on, man, we are stressed to the gills as human beings.
Yeah.
We're doing lots of things to avoid it. We're doing social media, we're working too much, we're avoiding in all of these ways, and substance use is just one way that people do this. And that we see that if we regulate anxiety through good therapy, medication management, but also a walk.
Yeah, natural things.
Fitness makes a huge difference. The changes that we've seen in our patients that are actually engaging in boxing, getting a release for some of their anxiety, and then also having time to look at the deeper issues to what's driving my anxiety. It really destigmatizes anxiety, depression, substance abuse. Those are all things that can happen when we aren't taking care of ourselves.
Not getting to the root.
Exactly, and that's our goal, is to get to the core of what's going on, and as the human condition, that we're all one step away if we aren't taking care of ourselves.
Well, let's talk about the fitness side of things.
Absolutely.
So same topic, right?
Yeah.
So anxiety, depression, release. How do you feel like fitness plays into this?
I think it's a perfect hand-in-hand thing. Fitness is a realm that's not locked down to just lifting or running. It's kind of all of these things combined into one field, but it's a great way to have a healthy release. To release the right endorphins in your body, but also to physically get some emotions out. I mean, it's kind of hard to be angry after a very hard boxing session where you're tired and you're gasping for air, but you're very proud of the accomplishment that you just did.
I've always found, so I trained in Muay Thai, which is essentially kickboxing.
Yeah, absolutely.
I've always found that to be meditative in itself.
Definitely.
Just the ability to kind of be in the moment, working out, everything else goes away, especially if you got punches being thrown at your nose.
Absolutely. So one thing with boxing that we do in particular is a lot of focus mitt work. And like you're saying, it's extremely hard to not only focus on my voice as a coach, what I'm calling, but your breath control, your body control, keeping your hands. I mean, there's so many different factors that you have to focus on in that exact moment. It's hard to kind of think about anything else
Right.
but that exact moment in time.
I'm certainly no doctor like Dr. Christie here, but it doesn't, and this is just stuff, that I've read.
Yeah.
Thinking in the future is kind of what makes you anxious, thinking of things in the past, kind
You got
of the depression side of things. But being in the moment, you're okay.
Exactly.
And doesn't that put you in the moment when you're working out,
Absolutely.
exercising,
Like
and
Andrew's
training?
saying, if you're focusing on his voice, breathing, your brain isn't thinking about, am I going to be able to pay my rent?
Right.
That may be an issue you have to deal with later. But right now, I can actually calm my nervous system in this moment. And we found actually, even in our groups, even on a lower scale from intensive circuit workouts or boot camps, that just doing a plank in the middle of a group when somebody gets flooded with anxiety, we think about just a little scientific piece here, the striated muscle, the kind of activation that can happen when we're really anxious. Most people will bounce their legs. Some people can get really anxious and dump into what's called the parasympathetic nervous system, and they just shut down with high anxiety. They get flooded. And when we bring it back into the muscle tension into the body, have them do a plank, a wall sit, and we'll do this in the middle of group if people are kind of flooded, they come back. They can't focus on navigating their core and their shaking legs and still be kind of blipped out. They come back in. It's been just amazing. That was really when we decided to bring Andrew on, was seeing how imperative this was for the work that when we're dealing with people who have lots of trauma or addiction issues and really can blip out with anxiety pretty quickly and dump into that parasympathetic nervous system. By reactivating the sympathetic nervous system, they come back online. They're able to do the work, and so often this is missed in clinical practice.
Sure.
So the physical piece makes such a difference as far as our effectiveness.
This stuff sounds so simple. It's a very complex world that we're in. I mean, we're consumed, we're waking up with this in our bed.
You got
I mean,
it.
it's just being
Absolutely.
projected on
Yeah.
you even if you don't want it.
Yep.
But some of the solutions that you guys are discussing, punching some
Right.
mitts, planks,
Yeah.
meditation, going on walks. I mean, these are very simple things that you can take action on right now. I'm going to encourage our audience to take action and meet with you guys. BoldHealthInc.com. That's where you can learn about everything they have going on. Fascinating conversation. Thanks for coming on the show.
Thanks
you
so
so
much.
much
We
for
appreciate
having
your
us.
time.
All right,
Yeah.
awesome.
Thanks.
More of the American Dream coming up next.